Hi there, welcome again to familydoctor.expert. Today we're going to talk about the Piriformis Syndrome and what you can do about it. What is it? It usually presents as a pain in the buttock and also some radiating tingling either down the leg or in the buttock or sometimes even into the groin. And what it's caused by is this muscle which lives in your buttock and basically connects your spine to your outer hip, and it's responsible for doing a lot of the little rotations in your hip. So it's a pretty important muscle. Problem is that there's a big fat nerve called the sciatic nerve, which either goes under or over or even sometimes through that muscle, and that nerve goes round your buttock, down into your leg, sometimes a little bit into the groin as well. And so if the muscle gets swollen or inflamed, it can irritate the sciatic nerve and give some very annoying symptoms. So the first thing to say about the Piriformis syndrome is it's really good to diagnose because it's very treatable and almost all of them get better. The other thing to say about it is that your doctor will want to have a look at you and make sure that it's not actually real sciatica, pressure on the nerve coming from your back. For example, a herniated back disc would be something that your doctor wants to make sure that is not causing that sort of tingling down your leg. But if your doctor thinks it's the Piriformis syndrome, there's lots that you can do to try and help you. So the typical signs of it, often people say they're sort of sitting on a chair on a little bit of an angle, trying to keep the pressure off the buttock. Often the pain's worse when you've been sitting for a long time. Walking upstairs can sometimes cause a bit of pain. And importantly, if you actually push, you can feel that the pain's actually in your bum, not in your back. So that's pretty important too. So what can you do? Generally, I send patients to a really good physio who can show the exercises, but I'm going to put some links on the familydoctor.expert website because there's some pretty cool YouTube videos which actually walk you through the various stretches you can do. I'll tell you a little bit about them. One of the stretches I really like is the sitting stretch. And what you do is you take the affected leg, the foot goes over the other leg and sit it up on the knee as shown, and bend the neck down whilst you have your leg crossed and hold for 10 seconds. And you do this 3 times in the morning and 3 times in the night. And this stretches out the piriformis muscle, and when you push your head down, it's also stretching and moving the nerve a little bit as well. So that's a great thing that you can do. A second exercise that's really helpful is lying down on the floor, again crossing the affected leg over your unaffected leg and pulling up the unaffected leg to stretch right in the buttock as shown here. So again, do these 10 seconds 3 times a day, morning and night, and it's really helpful for helping this syndrome. So as usual, don't make any decisions just based on this video. Always get proper assessment from your regular doctor. Hope it's helpful. All the best from familydoctor.expert.